Welcome to another edition of Inside Human Medicine, where we explore breakthroughs shaping the future of medicine. I'm your host, Henry Ford, the Dean and Chief Academic Officer of the University of Miami Leonard M. Miller School of Medicine. Today, I am thrilled to welcome to our podcast Dr. Raveen Syan. Dr. Syan is an assistant professor of clinical urology and a member of the Desai Sethi Urology Institute at the University of Miami Miller School of Medicine. Dr. Syan is one of the rising stars in the field of urology. She serves on the editorial board of several high-impact journals in the field, and she holds leadership positions in several surgical societies. Her research interests include pelvic floor disorders and disparities in the management of urologic disorders among minority women, just to name a few. Dr. Syan, welcome. It's great to see you again since last time when I placed your white coat on you as a medical student. But before you get into the substance of our discussion today and our own personal connection, please tell the audience a little bit about yourself, your journey that brought you now to your position as a member of the Desai Sethi Urology Institute and one of the leaders in the management of pelvic floor disorders.
Thank you. Yes. Well, I actually grew up in Canada first, and I was a child of doctors, very inspired by both my parents' intense compassion for patients, interest, dedication to the field. So from a very young age, I always wanted to be a physician. I actually came to USC, where you were the dean of education, when I started medical school. So that was my first time I came to America. My older sister was a fourth-year medical student, and she had actually already matched into urology. So she was definitely my greatest inspiration.
Family affair, huh?
Yeah, it sure is. And so she started her urology residency the following year. And so I thought, I got to check this field out. And one of the most inspiring things about urology, the field, is one, the innovation, the commitment to patients' long-term care, not only surgical, but medical, and just the opportunity to grow and learn. It's a growing, fantastic field. So that's kind of how I made my way through urology. Definitely she was the early ambition. When I finished my fellowship, so first I did residency at New York University, then I did a female pelvic medicine and reconstructive surgery fellowship at Stanford. When I graduated, I had already started to become very interested in research. Specifically minority care, so the disparities that we saw and understanding it a bit better. So when I graduated fellowship, I wanted to go to a position where I would have protected research time, a boss with a vision, the interest in supporting, my research and clinical ambitions. And Dr. Dipin Parekh, chairman at the time, now founding director of the DSUI, was just a perfect fit. And so that's how I found my way to Miami.
This is truly fascinating because most people think urology as a field that attracts primarily men and to treat male disorders. But here we have two sisters who have decided to pursue urology. Tell us, and single-handedly, I guess this family is responsible for trying to turn the tides because there are so few female urologists out there, right? Only about 11%.
That's correct.
Although at Desai Sethi we have about 14% women urologists on the staff, so quite remarkable. So is that one of the reasons why you chose to come to work here?
Well, I was actually the first female hire when I joined, so that was a little daunting.
A trailblazer.
So it was and it was a little daunting because, first of all, my sister was a urologist, so I had a very direct relationship with someone in the field who's female. And where I trained, there was a number of female faculty. And I think that models your interest and your belief that you can do it. I think one of the challenges females in medical school face is they think that there are certain fields they can't do because they're not the right fit, it's not suited for women, family compromises. And so I had the great privilege of being surrounded by ambitious women who showed me it's possible.
And what barriers, if any, did you encounter? It sounds like you shattered them anyhow, but let's share with the audience.
Well, I think the reality is you do have to work a little bit harder than men to be taken seriously, probably in all fields and definitely in male-dominated fields. So, maintaining your confidence and your belief in yourself, proving yourself, that I do think that, I had to put a little extra effort than I saw my male colleagues do. I often tell my medical students, I used to have a higher pitch of my voice. And when I started, rotations and interviews, I noticed that I felt a sense of being dismissed a little bit with my high voice. So I've actually deepened my voice. I have a lower voice than I used to have. Yeah.
Good. So why do you feel it's important for women to go into urology?
Well, the thing that inspired me initially was the reality that there are so many women with these pelvic floor issues, cancer, non-cancer, that just don't know to go to.
Let me stop you one
Yeah.
question. So tell us about pelvic floor disorders, pelvic floor issues, and is this a problem that affects men, women, and tell us. And
Yeah.
who's really affected about it?
So the percentage of women affected over their lifetime is very high. It's probably about 40%.
And why is that?
Well, the pelvic floor is often traumatized by childbirth and labor.
And that's whether you do vaginal delivery or C-section.
Correct, irrespective of that. Although, of course, vaginal deliveries carry a higher percentage of disorders.
And when you talk about disorders, people who may not understand, specifically tell us what those disorders are.
Sure. So when we talk about the pelvic floor, we're talking about the bladder. That can be overactive, going often and urgently to the bathroom, leaking. That affects men and women, though it is a higher prevalence in women.
For men, it's what? The prostate, or is it skipped up?
It can also just be inherent overactivity of the bladder. That can be just an inherent disease of the bladder. But yes, you're right. The prostate has a significant role to play as well. And then there's also pelvic pain. Again, affects men and women, but disproportionately women. Again, often associated with some sort of trauma, perhaps childbirth or the unfortunate things women may suffer. There is defecatory dysfunction, so troubles with constipation that affect the entire pelvic floor. And then there's pain syndromes, as I mentioned. So that can be the bladder or the pelvic floor.
So all of those things affect women disproportionately than men. So it's important for women to have an option to see a female urologist. Is that right?
Exactly. The number of women I meet who tell me that they feel so much more comfortable discussing these very sensitive issues, topics about sex, pain, vaginal bulges, prolapse. These things are very hard for anybody to talk to anyone about. And I know that women feel a greater comfort discussing these sensitive topics with women.
Good. So it's perfect time to segue to the substance of the discussion, which is the diagnosis and treatment of pelvic floor disorders in women in particular, and why there is a disparity. Since they are disproportionately affected, you would anticipate that this is a diagnosis that would be made readily and they would be able to be subjected to the proper or optimal form of treatment. But that's not quite what the research is finding.
No, I mean, it's very well shown that women are afraid to talk about it to providers, even though they're experiencing those symptoms. They don't talk to their primary care or even specialists unless they're asked specifically.
And why is that? It's a lack of awareness. I mean, let's get to those psychology of it.
Definitely a lack of awareness. That's absolutely true. And a big part of that is, if you ask any older woman, they'll say, well, it's part of life.
That's the way it's supposed to be.
Yeah. So this belief that it's supposed to be this way. And what I always tell patients is, it's true that it's common and we see it as you get older, but that doesn't mean we can't treat it and address it. And that's where I think the newer generations are seeing a shift in cultural beliefs, that they don't have to live with their problems. We can help them. There's also, providers don't ask. So there was a study done, only 10% of providers actually asked women about urinary issues, which is, a huge part of a person's life.
And how do these issues really impact someone's life?
It can be very severe. So people can have daily incontinence. So they're wearing pads every day. They're spending money on their pads. These things aren't usually covered by insurance, of course. Shame, fear of going out in public, avoidance of social situations. There was one study in the UK where they looked at people with specifically overactive bladder, and 50% of people with severe symptoms said it affected where they worked, the type of job they chose, and it gave them daily stress.
So serious problem, quite with high prevalence, but yet for whatever reason, no one, well, the affected patient is not willing to discuss it because that's the way, that's almost like a caste system. That's the way it's supposed to be. So how do we begin to educate the affected population that no, we not only is this not normal, we can actually fix it. We can help you with it. And besides this podcast, of course.
Yeah, well, I mean, that's really a big part of my area of research and effort and ambition is to improve education and awareness. And that does come down to literally communicating with communities, minorities, certain systems to make them aware of the options that exist. And really, at least, again, what I was saying before is be aware that it may be common, but you don't have to live with it.
So tell us a little bit about your findings in terms of awareness and treatment in minority women.
Yeah, so a study that I completed last year, which was funded through the AUA, the American Urologic Association, was examining minority women and asking—
Let me stop you there. Why did the AUA fund it? The American Urological Association decided to fund your research.
Well, fortunately, they recognized that there was a real need to treat minority women and figure out why they're receiving less treatments. So look at all women. So forget about men versus women. Let's just look at women. Minority women are consistently shown to be less likely to receive treatment. And this is even when you take into account insurance, area of the United States, age, despite all these, the things that we tend to think, oh, that's why you don't have access to care. Even then, Black and Hispanic women are much less likely to receive care. So why? We got to figure out why. So what I worked on was looking at the next step. So once we go past those kind of what we think as local factors, we look at social determinants of health. So this is safety, utility, housing, familial support. These things that go a step beyond just looking at the things on a chart and what actually impacts people's access to care. So we found that minority women were disproportionately likely to show greater barriers in these fields. Safety, education, transportation was a major issue in the Miami area. They just actually couldn't get to a physician. And one new thing that our study found is that when we asked people to speak to us about what are some of the barriers, we identified a new barrier, which is childcare. So while women may be very affected by their symptoms, they didn't have time because they had to take care of their children, which I think is very interesting. And it's unfortunate that we don't count that as part of a woman's daily struggle to take care of herself.
Now, this is fascinating. And by the way, I know you're just being modest. AUA gave you this grant because obviously, they recognize you're a star, a rising star. Now, but getting back to the issue, once you understand all of these social determinants of health, you understand the underlying problem. How do you begin to address a woman with pelvic floor disorders and who wants to have the help?
Well, I think that's where we come down to awareness and access to care. The University of Miami has this amazing program. I know you know about it, the Game Changer Vehicle, where it's this concept of mobile clinics, mobile community care. So we recognize there's underserved populations that don't have easy access to So they have these vehicles that actually go out and provide education. And so creating that link between these communities, not only making them aware, but also providing them guidance on how to access care is immensely important. And then when you actually have that patient in front of you, it's part of the whole conversation. You've got to create a good rapport, people willing to talk about, like I mentioned, these very sensitive topics. And, just to encourage them to go as far as they want to go. The choices are in their hands, fortunately.
For people who are listening and suffering from this very problem, the pelvic floor disorders, just give them a sense of what interventions you can do surgically or otherwise to actually help make things better.
Yeah.
Examples of some of those problems and how you treat them.
Absolutely. So all of them can start with just basic behavioral changes, which it sounds crazy, but the simplest things can help. Reducing caffeine, alcohol, avoiding these bladder irritants that people don't actually know are bladder irritants, like carbonated beverages, even sparkling water. You can do pelvic floor exercises, so you can work with a physical therapist.
But if you eliminate all those things, what's left?
So then there's surgeries. Like you said, there's medications I should mention that are highly effective, although people don't like to take medications. So fortunately, we have these fantastic surgical options. We can repair pelvic floor traumatic injuries or prolapses, for example. We can do innovative things like stimulation, neurostimulation. We can do Botox, like medications that we're actually injecting into the pelvic floor. Depending on the underlying issue, there's a huge range of highly effective interventions.
So that's fascinating. But depending on the nature of the problem, you have a whole buffet to choose from to actually provide some relief.
Exactly.
That is fantastic. And all of this is available right here at the University of Miami Middle School of Medicine through the Desai Sethi Institute.
Exactly.
And you are the one driving it.
Yeah, well, I have a partner, so we as a team drive it.
But you are the original.
I'm the original, that's right.
Well, this is fantastic. But I also recognize that that's not the only area of research interest. Although I must say, that's one that is extremely important. Pelvic floor disorder, I know, is something that is quite prevalent, and I have 5 sisters, so I know a whole lot about women as they age and some of the challenges that they face. So, but having said that, I'd love to expose some additional research interests of yours. And for this, we have a special guest today that we would love for you to introduce to the audience. And Christina, please come forward.
This is Christina Yarbrough, a wonderful medical student at the University of Miami Miller School of Medicine. She's a 3rd year now, and she's actually a dream scholar.
Yeah.
What is a dream scholar? You can come over with it.
A dream scholar it's the Dean's Research Excellence Award in Medicine. And thanks to Dean Ford, I was able to receive that for the past year.
That means you're really a superstar.
Oh, well, thanks to Dr. Syan, I've been able to explore lots of research opportunities. And it's just an amazing opportunity to have funded research, or to be funded throughout the year, and have time to be dedicated to research while not worrying about exams and stuff. So I'm very grateful for that opportunity.
Christina Yarbrough, welcome. Thrilled to actually get to interview a dream scholar, because since we've had this program now in existence for the last 3-4 years, and that's the first time I have a scholar on the program, so on the podcast. So fantastic. Tell me a little bit about why you decided to pursue to cultivate an interest in urology, and why you decided to choose Dr. Syan as your mentor.
So I've always had an interest and passion for women's health, specifically minority women. And I feel that women are often kind of forgotten in healthcare outside of the pregnancy period. So I did not know about urogynecology before I came here. And then I met Dr. Syan, and she's awesome, as you know.
How did you meet?
It was through a mentorship program. And we were
She volunteers to be your mentor.
Yeah.
I love it.
Yeah. And her commitment to minority health and just making sure that people who are largely forgotten during research are taken into account definitely made me gravitate towards her. And then actually seeing her in the operating room and seeing her amazing bedside with patients, I truly want to emulate everything that she's done. And I'm so grateful to have had her as a mentor for these past 3 years.
Well, it sounds like she's been an inspiration.
Oh, yes. Yes.
And how important do you feel mentorship is, especially for someone like you, who now is interested in gynecological disorders?
I think it's extremely important. As a Black woman especially, there's not a lot of people that look like me in medicine. And having Dr. Syan, a minority woman who cares about a lot of the things that I care about, has just given me the opportunity to see what I could do. And as Dr. Syan mentioned before, when you don't see people who come from similar experiences being successful, it's hard to imagine yourself in that position. But she's just guided me in so many ways and given me so much additional confidence. And yeah, I think mentorship is extremely vital during the medical school process. And I'm very grateful.
And so the notion that, well, you know, urology is a male-dominated field, you stay away from it, so that vanished.
Yeah, I mean, I think that I definitely will have challenges ahead. I think that there's probably people who maybe won't take me as seriously because I'm a woman. But who cares? I'm going to do it. I'm going to be successful. And Dr. Syan showed me how to be. So
I love it. I love it. But, it's great to see the power of mentorship, and I add sponsorship because clearly there's a lot going on right as well. And I know she's been not only supporting you, but making sure that you get an opportunity to present your work. And I want to talk a little bit about that work. So what is the research? I understand you're doing some research on microplastics. How in the world do we decide to study microplastics in female reproductive organs? I mean, why is that important? How did you get to that science?
Well, I think the whole world is recognizing that microplastics is probably a major, major health risk. And we're only really starting to dip our toe into understanding how and why. Microplastics is happening through ingestion, inhalation. They're byproducts of plastic, of course. And many studies have shown that we harbor microplastics in our tissues. Now, actually, no studies have looked at microplastic presence in female reproductive tissues. So our group did look at microplastics in penile tissue and confirmed its presence. So what we want to do is not only look at it in women, but we want to go a step further. So our current ongoing research actually is recruiting women who are undergoing a hysterectomy, either for a benign indication or an oncologic, a malignant indication. We are going to sample tissue of blood, urine, a stable tissue, like part of the uterus is called a myometrium, a proliferative tissue, endometrium, and examine the presence or absence of microplastics and its byproducts. And importantly, in the malignant tissue, it'll be the first study that's ever looked at presence of microplastics and its byproducts in tumor tissue in humans. So it's going to help us, I hope, better understand which tissues tend to store by looking at different stability of tissues, which ones are more likely to have the presence or not, or concentrations, and then start to enlighten, you know, are there possible roles? How do we think about how the body stores it, and what do we think the impact is?
Christina, tell us a little bit about your involvement in this research project. And I know you are a driver of, I guess you're the field soldier, making sure all these experiments are taking place. So tell us a little bit about that.
Yes. So as Dr. Syan mentioned, we did find microplastics in penile tissue previously. And then we thought, well, there's a lot of, as in most research, women are kind of not looked at the same way, but yes, exactly. So we wanted to make sure that was not the case with microplastics. And women are the people who typically carry babies, and that's also very, very important to see what's kind of going on in the uterus. And then there are various pelvic floor disorders and other pathologies that we don't know might be tied.
Right. And birth defects, miscarriages, I mean, it's so spontaneous. I mean, all sorts of things are happening. So microplastics potentially could be playing a role. So how do you assess for the presence of microplastics in those tissues?
So right now we are starting to collect tissue samples of the myometrium and the endometrium. We also are eventually going to look at blood and urine. And then we're going to, we're working with 2 different labs, Dr. Agarwal. He's a biomedical engineer here, and they will be taking, processing the samples and then taking photos to kind of see if they could count the actual
they have a way of quantifying the presence of microplastic. I was wondering, how do you measure microplastic? And how big is microplastic?
They're very tiny. But our hypothesis is, especially when we look at the tumor tissue, that there will be a higher amount of microplastics in that tissue.
And if we see a higher concentration of microplastics in those tissues, then we would potentially assume, I mean, this is an assumption, is not maybe a correlation, is not causation, but maybe they're influencing either female reproduction, in female fertility, or the development of some diseases. Right? Is that the logic here?
Yeah, so in mice models and rat models and in vitro, they've shown that it impacts mouse and rat fertility, carcinogenesis, and actually tumor proliferation, cell differentiation. So these kind of precursors or risk factors for developing cancer. So there's evidence in non-human models that there's an association. So what we're trying to show is there an association among humans? Now, like you said, it's not causation. And we've got a long way to go. This is a first early step to just prove that it's there, it's present in humans, and then we got to go further to figure it out.
Absolutely. Correlation is important, but then, we can worry about causation later. So it must require a lot of sophisticated machinery to actually detect microplastics, I imagine.
Absolutely. Right? So as she mentioned, Dr. Agarwal, who is a biomedical engineer through DSUI, he's one of my colleagues. He's using...
For people who just... The Desai Sethi Institute.
Okay, sorry. Desai Sethi Urology Institute.
Thank you.
He is using scanning electron microscopy to actually look at visible presence and concentration of the microplastics. We're also connected with Dr. Donnert, who's the chair of biochemistry, pardon, and Dr. Deo, one of her colleagues, and they're going to help us do further analysis on the byproducts, which is, you're right, it's very sophisticated, challenging. There's very few labs in the nation that can actually study this. So
I understand that there is a meeting coming up next week, right? Are you going to be presenting some of your work there?
Absolutely. So I'm a course co-director for the Desai Sethi Urology Institute Urology on the Beach Conference. That's what we call it. And as the course director, one of the things we started last year is we created a program called Rising Stars. So the whole intention of the conference is really to build our urology network with the top institutes around the nation and actually around the world. We have people from Canada coming, 3 people, and even someone from Europe, these highly esteemed urologists. So as part of the intention to create a network and collaboration and learn from each other, we created the Rising Star program, where a trainee from each institute will kind of showcase kind of the amazing work that they're doing. And so Christina will be presenting a lot of our work, including this microplastics work.
And that's what I was talking about. I'm all choked up. I was talking about mentorship and sponsorship. And what a beautiful example of exactly that notion. Not only do you get to work with a very inspiring and empowering attending, but just sponsoring you to actually present. So this is remarkable and something that you can really build on to build your career as a future prominent urologist. Yeah. So
and I was in my 3rd year attending. So I remember my very first time, I was just wide-eyed and just excited to meet everybody. So now that I'll actually be able to stand up at the podium and hopefully teach urologists something myself, that's very exciting.
So what advice do you have for other, let's face it, more than 60% of entering medical school classes now are women, and so the graduates more and more are women, and some want to pursue different fields, but many are really scared about the possibility of pursuing surgery for all the reasons you said before. So I would love for you to leave the audience with some advice and some guidance about how to pursue their interests and how not to be intimidated?
I think that's really hard, to not be intimidated. The first step I would say is find mentors. So just get in front of people, send an email, and don't be scared of rejection. It's okay. Some faculty, even some of my colleagues, they're just not good at responding and making space. But when you're in front of them and you ask them and you show interest, they're very receptive, and everybody loves to show young trainees all the good things about what we do and what we're trying to achieve. So try to fight your fear and don't be afraid to get in front of other faculty. And I would also, one thing that I feel as someone who prioritizes mentorship so much is it's because I had amazing mentorship. So this idea of like, make sure you're always paying it forward. And all that's going to do is create amazing growth for everybody, for you, for them, for the field. So this, it's important to commit to the younger generation. It's hard. It's time consuming. It takes away from other things, but to me, it's the most valuable thing.
Well, Dr. Syan, this is just a perfect place to conclude. Your words are truly inspiring, and I suspect that you have a long line of suitors because you're the ideal mentor and sponsor. So thank you so very much, not only for taking care of Christina, but also for inspiring so many others here, and for doing this amazing work, taking care of women with pelvic floor disorders. We are fortunate to have you here at the Desai Sethi Urology Institute. So, and thank you for your time, Christina, and for enlightening the audience. So I've enjoyed this. And I look forward to hearing more about microplastics in the future.
Absolutely. Thank you. Thank you for the opportunity.
And this has been another episode of Inside Human Medicine with two fantastic guests. See you next time.